Hi, welcome to this unique hair care initiative by IPCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory, and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, hair problem was associated with middle age when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and an increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today, we have with us Dr. Sumiti Pareek is a well-known dermatologist and hair transplant surgeon, has been practicing medicine for over many years now. She's MBBS and MD in dermatology and cosmetology and presently working as dermatologist at Engrace Clinic, Jaipur. Dr. Pareek has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing personalized healthcare services to her patient. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Pareek is aware of the need for the patient awareness and education about hair care and spending a lot of time in giving talks at various platforms across the country. Thank you, Dr. Pareek, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Thank you. Thank you so much, Mona, for inviting me.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया सो डॉक्टर टुडे वी आर गोइंग टू टॉक अबाउट हेयर केयर इन करंट सिनेरियो सो whenever we talk about hair care in current scenario the first and the foremost question which comes to our mind is the hair loss which is uncommon now so can you please enlighten us today what's normal and when to be concerned for
Okay, so it's completely normal to lose up to 100 strands of hair per day. So if you're losing up to 100 strands of hair, then you do not need to worry. That's completely normal. If your hair loss exceeds that, then you need to be worried. Then you need to see a dermatologist and seek treatment for it.
Okay, doctor. So, what's the alarm sign? Can you please, it's like whenever we see heavy hair loss, then only we should visit, or is there any other more sign and symptoms?
If there is patchy loss of hair, if you just observe a patch of hair loss, or if you observe that your hairline has been receding, or if the middle parting it has been widening, then also you need to seek treatment. There might not be visible loss of hair in these situations, but in these conditions you need to consult a dermatologist, or if you're experiencing extreme itching in the scalp and you've been losing more hair than your usual hair loss, then also you need to see a dermatologist. It could be a sign of an autoimmune condition. It could be sign of another kinds of alopecia, other kinds of alopecia. So in these situations, you need to consult a dermatologist. But if you are losing up to 100 strands of hair and your hairline is all right, your mid parting is all right, there's no patchy loss of hair, then you do not need to worry. It's completely normal.
Okay, very informative, doctor. So, now we don't know that what's the alarm sign, and why? What are the general causes? Why do hair loss happen?
Okay, so the most common cause is genetic, as we seen in patterned hair loss, which is called androgenetic alopecia in our language. So genetic is one of the most common causes. Then another cause is definitely nutritional deficiencies. Nutritional deficiencies may lead to hair loss. Hormonal imbalances, such as people who have PCOS or who have thyroid disorders, they may lose hair. They may experience exceeding hair loss. And other than that, stress is a major trigger, and poor lifestyle, such as if somebody smokes or consumes alcohol on a daily basis. So that could also trigger hair loss because of increased oxidative stress. Now, exposure to pollution or increased exposure to UV rays, it may also lead to hair loss. So basically, these are the common causes of hair loss, and these may lead to various conditions, hair-related conditions. And then autoimmune disease is also a plethora of autoimmune conditions such as alopecia areata or lichen planopilaris or lupus. All these conditions may also lead to hair loss.
Okay, doctor, that's very interesting. So, doctor, can a lifestyle or so like a personal lifestyle can also play a role in hair loss?
Yes, definitely. Lifestyle has a major bearing on hair loss. Like If somebody has a very restrictive diet, like we see these days, a lot of people are on restrictive diets, so it could lead to hair loss. If somebody has a non-restrictive diet but is not taking the right nutrients, then also it may lead to hair loss. Circadian rhythm, it has a major bearing on hair loss. Like if somebody is not sleeping on time, not waking up on time, it could mess up his circadian rhythm. It could lead to hair loss. Stress, like I said, is a major trigger for hair loss. And again, pollution, exposure to UV rays, all these conditions, all these lifestyle factors may lead to hair loss.
Okay, doctor. So, like now that we know that why do hair loss happen and what are the causes, so then another question comes up to our mind are the medical treatment. So, can you please enlighten us today? What are like medical treatment option available for hair loss? Is there any topical or surgical or non-surgical, or we can just have a oral treatment also to manage our hair loss problem?
Yes, first of all, there are a lot of topical treatment options available. The most common, the most popular one is minoxidil. So yes, minoxidil can be applied. It helps in mainly in androgenetic alopecia, which is pattern hair loss, and it also helps in alopecia areata and in even severe telogen effluvium. So it helps in a lot of hair loss, hair alopecia, a lot of causes of alopecia. Another thing, topical ingredients such as Redensil, Anagen, Procapil, Capexil, they may be used. Topical peptides are in range these days. Topical corticosteroids and topical immunomodulators such as tacrolimus and tofastinib may be used for autoimmune conditions. And then there are oral drugs. In oral drugs, there is 5-alpha reductase inhibitors such as finasteride, dutasteride, which are used in pattern hair loss or androgenetic alopecia, like I said. And then even oral minoxidil, low dose oral minoxidil is being increasingly being used these days. And then there is oral nutraceuticals, oral multivitamins, and then even oral immunomodulators may be used. Non-surgical options like PRP, platelet-rich plasma therapy, can be used. Growth factor concentrate, it is also in range these days. And then we can even go for surgery in advanced cases of hair loss. So we can perform hair transplantation through FUE, FUT. So these are all the options that a patient has.
Okay, so wide range of treatment are available. We should visit to the doctor for the right kind of a treatment. Okay. And that's very interesting, doctor. So, doctor, nowadays there is a word called nutraceutical, which is getting a lot of focus. So, can you please enlighten us what is nutraceutical and what is the role of nutraceutical in hair health?
Yes, nutraceutical is basically any substance which is derived from food that is known as nutraceutical. So it covers a wide range of molecules. So there are multivitamins, like micronutrients are included in it, plant-based extracts are included in it. So yes, nutraceuticals are being increasingly used these days, and they also have promising results in hair loss.
Okay, doctor. So, doctor, in the internet also, like there are so many like herbal and plant extract and phytoconstant used in the management of hair loss or like alopecia. So, can you give us some example? Like, are they useful? And if they are useful, what are they?
Yes, a lot of plant extracts are being used these days, and there are a lot of studies which have been conducted, and these studies have also found these plant extracts to be useful in hair loss. Like ashwagandha, we all are hearing about ashwagandha these days. So, ashwagandha basically, what does it do? It decreases the level of cortisol in our body. So, cortisol is mainly the stress hormone. So, it leads to increased hair loss. So, ashwagandha decreases cortisol levels, so it helps with the hair loss. Then curcumin, which is derived from turmeric, haldi. So it has antioxidant properties, anti-inflammatory properties, immunomodulatory properties, and it also decreases the expression of androgen testosterone receptors on our hair follicles, which leads to pattern hair loss or androgenetic alopecia. Then another ingredient which is being used is piperin. Piperin is basically derived from peppers, black pepper and long pepper. So piperin also increases the level of curcumin in body. So it's used with curcumin usually in combination with curcumin. Another thing that is being used is saw palmetto extract. So saw palmetto extract basically inhibits this enzyme called 5-alpha reductase. 5-alpha reductase is responsible for converting testosterone into its active form. So it prevents the conversion of testosterone into its active form. As a result, it has very promising results in androgenetic alopecia, and a lot of people are preferring it to finasteride, as finasteride may have a lot of side effects, though it is not as effective as finasteride. But if somebody is in the early stage of androgenetic alopecia and does not want to experience the side effects related to finasteride, such as erectile dysfunction or decreased level of PSA, so those people can be prescribed saw palmetto extract. And then tocopherols, which are vitamin E derivatives with strong antioxidant property. Even marine collagen, we are hearing about these collagen supplements a lot these days. So marine collagen also has a role in hair loss. So marine collagen, it also has antioxidant properties. It promotes, definitely it promotes the synthesis of collagen, natural collagen in the skin, but it also has antioxidant properties. So it prevents oxidative damage both to the skin and hair, and so it may help in hair loss. So all these, a lot of plethora of nutraceuticals and plant extracts are being used these days for hair loss.
Okay, doctor. I mean, that's quite interesting. So, doctor, even like, people are saying like a plant extract like grape seed and omega-3 fatty acid, do they promote hair growth?
Yes, grapeseed oil, there have been studies, there have been researches that have been conducted on grapeseed oil and grapeseed extract. So, yes, it also has promising results in hair loss. What does grapeseed extract basically do? Your hair cycle has 3 stages. So, the last stage, once the last stage ends, your hair is shed, and then the hair cycle starts again. And from the last stage, the hair follicle enters the first stage again, which is the anagen or the growing phase. So grapeseed extract basically promotes or accelerates this entry from the last stage into the growing phase. That is the first stage again. So there is less gap between the last stage where after which your hair is shed and the growth phase. So it definitely hastens or accelerates the growth process. So it is a very nice plant extract or nutraceutical. Another thing that you talked about is omega-3 fatty acid. Omega-3 fatty acid, I think it is one of the most important nutraceutical for skin and hair, and it is definitely a magic ingredient. So I prescribe it a lot in my practice. So what does it do for the hair basically? So it has antioxidant properties, so definitely helpful for the hair and nail. It has anti-inflammatory properties. It increases the blood circulation to your hair follicles, so definitely improves hair health. And it also has androgen modulating activities. So even in male pattern baldness or female pattern baldness, it is very helpful. So yes, omega-3 fatty acids are also very helpful.
Okay, doctor. So, doctor, now that we know what are nutraceutical and there are so many component in nutraceuticals, so there is another word also like macronutrients. So, can you please enlighten us what's like micronutrients, and what's their role in plant like hair health?
Okay, so a lot of us we manage to get enough macronutrients, but we are deficient in micronutrients. Most of us are deficient in micronutrients, and micronutrients deficiency. This deficiency of micronutrients is a major cause of hair loss among especially young girls. So micronutrients, all these minerals and vitamins such as iron, vitamin D, zinc, selenium, and these are all micronutrients. So basically, mainly iron and vitamin D. Iron deficiency anemia probably is the most common cause of hair loss among females in India. So yes, you should always get your iron levels checked and take iron supplements. So iron, vitamin D, the most important two minerals or micronutrients for hair health. Other than that, uh, for hair health, these micronutrients are also important. Such as selenium is very important. Zinc is very important. Iron, vitamin D, selenium, zinc deficiency, all these deficiencies may lead to premature graying. So it is also important to maintain or retain that pigment in your hair. So for overall hair health, definitely these micronutrients are very important, and more often than not, people are deficient in these micronutrients, and they may be a major that deficiency may be a major cause of hair loss.
Okay, doctor, that's very interesting. So, doctor, like, like some people are, they really do. And even on like internet app also, they like keep saying that if you take more of the nutrients, you will get more of the benefit. So is it required to take this nutrient as per gender RDA requirement, or we can just take it blindly?
Yes, definitely recommended dietary intake is definitely recommended. So many multivitamins and nutraceuticals that are available in the market, they are according to that recommended dietary allowance, and it is important that RDA should be met. If it is not met, then it may definitely lead to deficiencies in the body, and those deficiencies may have implications such as hair loss or other skin conditions. So definitely RDA is important. Recommended dietary allowance is important.
Okay, doctor. So, doctor, like now we have talked about hair loss, and there are so many causes. So, can a dandruff can also cause a hair problem, because it's another common problem which is faced by all of us. So, can dandruff cause a hair loss?
Dandruff in itself does not cause hair loss, but dandruff in a lot of individuals leads to a lot of itching. So the patient has this tendency to itch and excoriate the scalp skin, which leads to trauma. It may aggravate the inflammation that is already there because of the dandruff. So that trauma and inflammation lead to hair loss. Dandruff per se, does not lead to hair loss. But usually we see hair loss in dandruff patients, because of this trauma and inflammation.
Okay, doctor. So, doctor, like nowadays we, like before also you have mentioned that there is a like impact of stress for on our hair health. So, can you please a little elaborate and enlighten us the impact of stress on our hair health? Because I think all of us are stressed nowadays.
Yes, yes. I think hair stress has a major implication on all types of hair loss, except infections. Obviously, if you do not have infection-related alopecia, then stress might have an implication. Stress might have an implication in the form of hair loss. So definitely, what does stress do? So when there is stress in your body, stress hormones are released. So there is increased release of cortisol, and this cortisol, it basically accelerates the entry of hair from anagen to telogen. So the growing phase to the last phase, and after which the hair is shed. So the length of your hair cycle, it reduces. So obviously you experience increased hair loss and stress. It may lead to telogen effluvium. This condition is known as telogen effluvium. And even in other causes of hair loss, such as in patterned hair loss, stress is a major trigger. Like a lot of people come to us. My father started losing hair in his 50s, but I've started losing hair in my 20s. So definitely stress is a factor, and the environmental factors also have a bearing on it. So that stress also has a role on also has an effect on androgenetic alopecia. Even in autoimmune conditions such as alopecia areata, stress may be an aggravating factor or even a triggering factor. So yes, stress has a role in hair fall, definitely.
So, unlike any other disease, stress is also impactful for hair health. So,
Yes.
doctor, like when we are stressed at home, the most common thing which is, uh, actually told by our mother, like oil लगा लो, massage कर लो, and जितना ज़्यादा चमके और जितना ज़्यादा oil लगाओगे, आपके बाल भी, grow करेंगे, shine करेंगे. So, what do you think, that oiling hair is a ban or a boon?
Okay, according to me, oiling hair, it is a two-edged sword. So if you're oiling your hair properly, like if you're applying oil 30 to 60 minutes prior to shampooing your hair, that's all right. Massaging definitely improves circulation to the scalp, and it helps in releasing stress. So it is a stress releasing activity also. It has been promoted as a releasing activity in our households. So definitely that is okay. You may apply oil, and I recommend coconut oil with a few drops of rosemary oil to my patients. So that is okay if you're applying it 30 to 60 minutes prior to your shampoo. It's completely fine. But if you're leaving it on your scalp overnight, then your scalp will become a breeding ground for all kinds of infections, especially for fungus, and it will lead to dandruff, and you'll scratch your scalp more, and it will lead to more inflammation and then more hair fall. So yes, it completely depends on how you're applying oil, which oil you're applying, and whether you're leaving it on for a long period of time or not. Otherwise, definitely oil is also a great conditioner. If you're applying coconut oil to your strands, then it will condition your hair. As a result, your hair will get tangled less. There will be less hair breakage. So yes, oil is helpful, but you shouldn't leave it on your scalp for more than 60 minutes.
Okay, doctor, that's interesting. Doctor, can you give us important tips today for healthy hair?
Yes, definitely. So first of all, your skin and hair is partly what you put inside yourself. So eat well, have a very balanced, healthy diet. Do not follow restrictive diets or do not fall for diet fads. Second thing is maintain a very nice circadian rhythm. Sleep on time, wake up on time. That is also very important. Third thing that I recommend my patients is that decide the frequency of your shampooing according to the condition of your scalp. So shampoo regularly. If your scalp needs to be shampooed, needs to be cleaned every 2 days, then that is okay. You can shampoo every 2 days. It completely depends on your skin. And then always condition your hair strands, because if you condition your hair strands, obviously your hair strands will get tangled less. There will be less hair breakage. Avoid heat styling, frequent heat styling. Always apply a heat protectant before styling your hair. Avoid chemical styling such as all these keratin treatments or hair botox or everything. Avoid all those chemical styling, and then avoid always protect your hair with a scarf while you're in the sun for long periods of time. That is also very important. UV rays cause oxidative damage to your hair, so definitely do that. And if you're experiencing increased hair loss, consult a doctor, consult a dermatologist, and seek treatment.
This discussion was very informative, doctor. I'm sure our viewers would be benefited by it. So, doctor, can we take some questions from our live audience?
Yes, definitely.
Doctor, I'm facing alopecia, and doctor has prescribed me vitamins and minerals. Do I need to take these minerals and vitamins for whole life?
Yes, in androgenetic alopecia, like vitamins and minerals, they do not have the central role. The central role definitely minoxidil and finasteride have the central role, but there have been studies which suggest that these vitamins and minerals, they may help in androgenetic alopecia. So if the patient is not reluctant to take a lot of medicines, like a lot of times the patient is very reluctant to take oral medicines, and they're like, I cannot take any oral medicines at all, or I just want to take one oral medicine. In that case, I would rather prescribe finasteride or dutasteride. But if the patient is not very reluctant to take medicines, yes, nutraceuticals, multivitamins, they can be prescribed. There have been studies which suggest that these multivitamins, especially vitamin D and iron, they help in androgenetic alopecia. So, yes.
Okay, doctor. Another question from our audience is I'm 35 years old, male doctor, and I met an accident of burn, and my scalp area is not having after that accident hair. So now can I go for hair transplant surgery? Will it grow back my hair?
Yes, hair transplantation surgery can also be performed to donor sites which have significant scarring. So yes, you can go for recipient sites which have significant scarring. So if you have a donor area, if you have enough hair in your donor area, yes, we can perform hair transplant to scarred regions, recipient sites which have significant scarring or burn scarring. So it can be done.
Okay, so even the burn people can also go for
Yes, yes, they
okay,
may.
that's interesting. Yeah. Another question from our audience is, I think every female wants to know, can hair spa grow hair back, doctor?
No, no, hair spa cannot do anything. Hair spa just has conditioning role. So it will condition your hair. It doesn't help with hair fall at all. And this is a common fooling tactic of people at salons. And but don't fall for it. It does not help with hair growth at all. So if you're experiencing hair growth, you should rather go to a dermatologist and get a few blood tests done. And the dermatologist will start you on appropriate medication, and you shouldn't seek medical advice definitely from people at salon who do not have enough training and experience in that field.
Okay, another question from our audience is, Doctor, you said premature gray hair. My daughter is 12 years old and she's having gray hair. That does means she's having premature gray hair. And what are the treatment options available for her? Why she's having gray hair?
So definitely, gray hair is a major problem these days. Premature graying is a major problem these days. So premature graying can be attributed to nutritional deficiencies. It can also be attributed to oxidative stress. This oxidative damage to hair may occur because of increased stress. It may occur because of increased pollution, UV damage. So there are a lot of factors which may lead to premature graying, and in a lot of cases it is also because of genetics. So if your daughter is experiencing premature graying, it is impossible to turn a gray follicle back to a pigmented follicle. So this should be made clear. That a gray follicle, a follicle that has become gray, can never be turned back into a pigmented follicle, but we can arrest the rate of graying, or we can slow down the rate of graying. So she should be prescribed all the necessary vitamins and minerals. Calcium pantothenate has a good role, and other than that, selenium, zinc, iron, vitamin D3, they also have a good role. So you should consult a dermatologist and seek treatment. So yes, you can slow down the rate of graying, but the gray hair follicles, they cannot be turned back into pigmented hair follicles.
Okay, so future graying of hair can be controlled instead of,
Yes, it
yeah.
can be controlled.
Okay. So, Doctor, we are running out of time. I'll just quickly take the last question from our audience. Doctor, my wife is 45 years old, and whenever she's stressed, she break her hair, and due to that, she have a lot of breakage of hair. Can these hair grow back, and why she break these hair whenever she's stressed, and she do it very oftenly?
Okay, I'll have to see your wife to confirm it, but your wife might have this condition called trichotillomania. In trichotillomania, the patient has this habit of compulsive pulling of hair. So obviously, the patient, whenever the patient experiences stress, this is how they release the stress. They pull the hair out of the scalp. So you have to consult a dermatologist and a psychologist, a psychiatrist simultaneously. You have to take the necessary medications. Your wife might be under a great deal of stress, and that is why she's probably doing this. And yes, in early stages, when your wife has been pulling the hair and there's no scarring in the scalp, then the hair can grow back completely. But if your wife has been doing this for quite some time, and if there is any sort of scarring in your scalp skin as a result of this, then it might be difficult to regrow that hair. So you should consult a dermatologist and a psychiatrist as soon as possible and seek the necessary medical care.
Okay, Doctor. Thank you so much, Doctor, for sharing so much of information and all your expertise with us today. I am sure our viewers have enjoyed this show. Doctor, would you like to give a take home message or any other suggestion to our viewers today?
Yes, yes, definitely. Thank you so much for inviting me, Mona. Thank you again, and it was a great experience. So, the take-home message definitely is that do not take advice from people who are not trained to give you advice about a particular uh, in a particular field. And another advice is always trust your dermatologist; they know better. And take all the necessary medications. There are a lot of medications, lot of options available these days. So just trust your doctor and do not take too much stress about hair fall. Consult a doctor and start your treatment as soon as possible. In most of the conditions, the hair can grow back completely, and the hair fall can be arrested. So instead of taking stress, and instead of consulting people who do not have enough training to give you the advice, to give you the medical advice that you need, consult a doctor.
Thank you so much, Doctor. Thank you. It was delight to have you, and thank you so much for your valuable time and answering all the questions of our viewers. I'm sure our viewers have found the session very helpful.
Thank you. Thank you so much.
Thank you, ladies and gentlemen, for joining us today. This is Mona Sharma signing off for today. Thank you, Doctor. Have a nice evening.